Join us in another educational journal club where we actually bring together a group of plastic surgeons in my practice and our fellows, and we talk about what's new, what's hot, and what's on the horizon. In this case, it's going to be about facelift surgery. And of course, I'm an expert in facelift surgery as well as rhinoplasty, so we're going to talk about the recent literature on facelifts and how it's changed and what a natural facelift looks like, and how we can make it better and safer. And as you know, plastic surgery is all about giving back and making sure that the next generation not only does it as good, but better, and makes innovation. So join us in this amazing journal club where we teach others to be the best they can be. Remember, in medicine and life, giving back matters, and if you want to be great, you've got to train with the best to be the best.
Plastic surgeons for many, many years. Reg, you want to talk about your background?
Yeah, so I was head of Dermic when we launched Sculptra into the U.S. many moons ago. That was the first cosmetic indication for our product of its kind. But I think to Chad's point, Dr. Rohrich, thank you again, become the filter for. So there's a lot of different mechanisms in how our products can and are used in the market.
Oral products, the feedback is always coming back to a practice saying, I want to continue that product. I felt better, I had a better mood, I was in a better mood, I slept better, and I had less anxiety.
We do facelifts, and just some very short overview about an article that may or may not be pivotal, and then we'll go to presentations that both Mike and Jeff are going to present cases, and then Matt's going to present one, and then I'll present.
Lift technique. And so the article goes on to describe the different techniques for each of those asymmetries and how you can correct those asymmetries. So for a wide face, limited skin undermining is performed in that and for a wider face, you do more oblique smazectomy and plication. And so after those 50 patients were observed, basically the asymmetries between the two sides went down significantly.
You know how unbelievable it was. It was actually an injector from, I think, LA, and she put his symmetric. She put left and side together that were symmetric, and he looked terrible. He looked terrible, right? And then when you put his asymmetry together, he was that handsome dude that we all know, you know, in the Raiders of the Lost Ark. It's unbelievable.
So this is my big question. Okay, so I've also seen at an ASAPS meeting, I forget which one, is years ago, but someone did that. They put like two halves of the face. Why would you change your surgery to correct the asymmetry to make it more symmetric when you know that's making them less attractive?
Yeah. Well, that's a good question.
Why would you treat the wide face different than the long face? You should do the same to keep them asymmetric.
But you also want to make it more youthful. That's when you add the fat.
When you elevate properly, you should just plicate it. It's refreshing to see that they actually do say that. I think they probably do underestimate the amount of motor branch injury they have. And the other thing I don't think they really talk about a whole lot, and a downside of doing a significant SMAS dissection is swelling. Things like need for drains more than a day or two, which Tim Martin has found and said that he needs drains for weeks after these operations. And so, you know, it's and then the other thing that is sort of this was great for the time, but now we have a much better understanding of fat grafting. And
that was before fat grafting.
This is pre-fat grafting. The results look fantastic for pre-fat grafting era results. But what we have now, we have something else that can rejuvenate the mid-face more safely and arguably more effectively. And so, you know, I think it's a great paper for the anatomy for this technique. But I think it's also, you know, a paper that's kind of its time. And now we recognize some other shortcomings they don't really discuss so much. And we have more tools, i.e. fat grafting for mid-face rejuvenation.
With Morpheus, they evaluated the patients at a week, 3 months, and 6 months. And then they assess them by blinded investigators with a non-standardized assessment protocol, and they showed a marked improvement in 2/3. But what we really wanted to talk about is the use of radio frequency both at the time of a facelift. It hasn't been written up in the literature, but a lot of people are showing